Um, Welcome to the Zoom room for the Public Health and Human Sciences Ask Alumni event. And I'm very happy to be here. My name is Casey Farm. I'm the Director of Alumni Relations for the college. And I want to let David, my co-moderator, introduce himself as well.
Hi, how's everyone doing? My name is David, and I'm the Director of Admission and Recruitment for the graduate programs here. It's great seeing everyone.
So before we kind of get going, one of the things I want to just say, like if you, we had some questions that were submitted in the early portion during the registration period, but you know, this room is meant to be very casual. It's meant to be very informal. And so if you have questions, feel free to raise your hand and we can call on you at any point in time for any one or all three of our panelists. You can also direct message David or myself if you're really shy. You can do that in the chat button, say like, here's my question, but please do not use my name. I like to hide behind, you know, my picture. That's perfectly fine too. Whatever you're comfortable with. The point is like David and I can sit here and ask the panelists questions, you know, for the next, 45 minutes or so, but really this is meant to be your time as students to be able to kind of interact with our three panelists. And so again, any point in time, you know, feel free to, you know, raise your hand or shoot us a DM and we'll make sure to get your question answered. But before we get started, I wanted to be able to go through and have each of our panelists introduce themselves. And Marissa, let's go ahead and start with you this evening.
Hi, my name is Marissa Song Maeda. I go by she, her pronouns. I'm originally from Southern California. I did my bachelor's in health science at Cal State Long Beach with a double option community health and school health education. I thought I wanted to be a health teacher for a second there. I ended up moving in 2017 to Oregon State University for my MPH in health promotion and health behavior. And then after that, I did my master's in public policy, and now I'm a first year medical student at OHSU.
Wonderful. Evan?
Hi, yeah. My name is Evan Hilberg. I was born and raised in Corvallis, and then went and did undergrad at Linfield, now university in McMinnville. And after that, I got a first master's from Eastern Washington in Spokane in exercise physiology, and then enrolled in the PhD program at Oregon State. And then shortly after that, also enrolled in the MPH in biostatistics, and did that concurrently with my PhD in exercise science. So left Corvallis for a little while, but came back, still live here, work remotely for a healthcare company called Cambia Health Solutions.
Wonderful, Evan. Thanks for being here. And Hallie.
Hi, everyone. I'm Haley Leslie. I use she, her pronouns, and I am originally from Michigan. I did my undergraduate at Hope College in exercise science and psychology. After graduating, I moved to Oregon and I earned my MPH at Oregon State. And then I've worked at local public health authorities in Oregon, and I now work at the State Public Health Authority. I'm one of the managers on our COVID-19 response and recovery units, and I also have an MBA, Master's in Business Administration from Bushnell University.
Excellent. Thanks for being here as well. Really, first and foremost, one of the questions in the registration period that kind of really jumped out, and either any one of our three panelists can start off first, and this is really for all three. And it talks about something that I think that we're all very familiar with at different stages of our life. I'm going to go ahead and tell you, as you get older, it doesn't really change. It just kind of modifies. And that is the question, if you've experienced imposter syndrome while searching for jobs or starting a new job or in the kind of the field that you are, what did you do to overcome that? And so open to any one of the three panelists that want to go first. Talking about a little bit about imposter syndrome, especially when you get out of college.
I think it's a normal thing. I think it mostly comes from lack of experience, but not always, because some people have been in their jobs for a really long time, still continue to feel that. But I think just having the courage to do something and being willing to do it poorly or wrong or make mistakes and then learn from those is really important. But of course, you have to be in an environment that allows that and supports that. So sometimes it could be tough if it feels like you can't do that. But I think, forging ahead with that, and if the environment doesn't support it, then maybe it's time to find a new environment, whether that's a job or a mentor or graduate program, whatever it might be. But I think it just takes that courage of taking that first step, and then as you do it more and more, the process of doing it becomes easier, but it's still a difficult task to move forward. But taking that step becomes easier over time, I think, albeit it still becomes difficult to always do it all the time. So
Great. Haley, Marissa, anything you want to add to that?
I think for me, a lot of it is really having a growth mindset and knowing that I'm not going to have all of the answers, and that's okay. And kind of like what Evan was saying, finding a work culture or wherever it is that you are that really helps you to grow. And part of what I've done is fostering close relationships with colleagues in my different work settings, so then I can go and have those safe places to say, hey, this is how I'm feeling today. Like, do I actually know what I do? Like, is this, and then being able to have those conversations. And then that's something as a manager that I really try to do with my teams too, knowing that I've experienced that. And so I know that my teams or, my staff is likely to feel that as well.
Do you feel with, being, a manager in a management role, really having that top of the mind of part of your consciousness and your leadership style, has that shaped your leadership style in a way that you weren't expecting, or just like, oh, that's something that I'm really glad that I keep that in the top of my mind because it's something that is really fulfilling, or again, it's just something that was unexpected?
I think this is part of it. I mean, I was also a collegiate athlete, so like there's kind of that part of it too, of like knowing that we couldn't do things without our team, and there were definitely those days where like things just weren't coming together, whether it was during a practice or a competition or whatever that looks like. And so I would say it wasn't necessarily this is how I'm going to approach my management style, but it was something that developed and kind of had one of those aha moments of this is actually a culmination of a lot of things over the years and being on teams and with all different types of aspects that has built into my management style.
Appreciate you following up on that. Thanks. Marissa, anything that you want to throw in?
Yeah, I'll say that I've had imposter syndrome like hard through undergrad, through applying for grad school, even now in medical school. I think it's one of those things that will always be in the back of your mind that you kind of learn to deal with. For me, what really helped was really relying on my support system. I had mentors, friends, and things like that where I can talk things out. I also used to use the mental health services on campus. And that was really helpful. And I think also just remembering that you wouldn't be in the place that you are right now if they didn't think you were ready, or they didn't think you're going to be successful in that role. So definitely you think of that as you go forward, because having imposter syndrome can be self-limiting when it really doesn't have to.
Appreciate that. Thanks, Marissa. David, you got the next question.
Oh, I think
Caitlin,
you have a
yeah,
question?
yeah, thanks. That's that was my question that I submitted. So thank you all for those awesome responses. I feel like a lot of that was really resonant and great advice. And I was wondering if I could just kind of follow up. A lot of that feeling for me right now is kind of entering into a career. And so looking at job descriptions and reading these and knowing, as you said, Marissa, that I have been trained, I've had these skills built, but making sure that I can, if there is something that's maybe like, oh, I don't have a ton of experience in that, but I've been told, like, don't be discouraged from applying just because you don't have, this, and this, everything, but just kind of how to navigate that in an interview or in the application process. Yeah, any of you can speak to that a little bit.
As a hiring manager, I've hired a lot of people throughout the COVID response here, and I've seen all types of cover letters and resumes and experience. And I have people on my team that come from all different, they're not necessarily public health specific, but thinking like they have the interpersonal skills. They have different experiences. So as I'm building out my team, I want a team that has diverse experiences that are going to come together and help us serve communities that are needing help throughout the COVID response. So I would say apply for positions even if you don't think you're qualified for them. If it sounds interesting, go for it, because there's the way that different agencies have their hiring processes. It's different. Like sometimes you get information sent directly to the hiring manager. Sometimes it has to go through HR. Sometimes, I mean, I've had people where they scored lower on the initial questions. And I was like, you know what, with some of the stuff in their resume that they're calling out or examples that they gave in their cover letter, I said, I want to interview these people because I think that they might have something. And then when you make it to the interview process, really like speaking to what's in that position description and doing the research on the agency. What do you bring? What are the different experiences? How do you work within a team? There's a lot of that kind of stuff that you can really highlight throughout the process.
And I would just add that a lot of job descriptions, it's as the applicant interpreting what those things really are asking for. Although it may say X, Y, and Z, like what do they really care about, or what does that really mean? And the other side is that, to Haley's point, is that most hiring managers and most teams want to be working with reasonable people that are willing to learn, that are nice, things like that. So whether you meet the perfect list of qualifications, that might get you in, but in the interview process, I think you can make up a lot of ground by being a reasonable person. That's a pretty low bar, but shockingly, it is sometimes hard to find someone that feels like they'd be great to work with. And you get one shot, right? Maybe half hour, an hour to really interact with that. And in Zoom, for a lot of these interviews, that can be even harder. So coming off as somebody that's great to work with, that's willing to learn, that may not have all the experience in the world, can go a really long way for a lot of positions.
So I think I'm one of the newer ones into the workforce. So I got my MPH in health promotion and health behavior. And right after, during my MPH, at the end of it, COVID was starting, and I got offered a position at Linn County Public Health to be their first epidemiologist. I took the job, but it was one of the scariest experiences ever because, my background is in health promotion and health behavior. And I've taken some epi classes. I've taken a lot of biostats classes. I didn't think I'd be a good fit. But I just kept on going at it. And I realized afterwards, and looking at the position description, even though I didn't fit every single thing, I did have transferable skills that are related to the job posting. So for instance, my background has been with sexual health and tobacco prevention. And with tobacco, when in the epi position, I was doing a lot of food security work. So when I was working, I was able to say, like, I know a lot about tobacco. This is transferable to knowing a little bit about food insecurity, food environments, and policy. I think also just trying, as everyone has said, to apply for things, even if you're not sure. As long as you're passionate, I would say give it a shot, because you might be surprised. I'm surprised that I even was able to become an epi or even still in med school. So definitely give it a shot.
Thank you for that.
And thank you, everyone. Is there anybody else that has any other questions before I go ahead and ask my question? Want to make sure I provide the space. All right, then I'll ask my question. So this question actually comes that came in as well, and that's really asking if they want to hear a little bit about your experience as far as finding internships, maybe after graduation, if you had to go through that. If not, maybe finding, how the job searching went for you after graduation, and kind of the experience that was for all of you.
I guess I'll start again. Mine's situation is a little bit unique in the sense that I started a full-time work during my PhD program, and I was doing my MPH concurrently. So it was sort of an unusual scenario, but the not unusual part of it is that someone that was an MPH epi grad while I was doing my biostats MPH had finished and I was continuing on to do my PhD, had gotten a job with the company I'm at, and then a year and a half later, they had an opening within the company. It was remote work even prior to COVID, and she said, "Hey, come work for us." She had an FE, which, as some of you may know, it's basically the same as biostats degree minus a couple classes. So she knew the skills that I had gone through that program. So it'd be a great fit. It's research-based. It's medical policy, which no one knows what that means. It doesn't matter. If you have the research background, we can teach you that side of it. So talked to my advisors, and they were supportive and said, "Yeah, go ahead and apply." I just finished my coursework, was about to, and just had my dissertation left. So it was sort of convenient timing in that sense too. So I applied and got the job. So finished my dissertation while working full-time remotely. So I was able to stay in Corvallis and stay in touch with my graduate advisors and get everything done. But my job that I'm still in now, 5 years later, was directly attributable to relationship as a classmate while in the MPH program at Morgan State. So
Thank you.
Yeah, after I graduated with my MPH, I did a year of AmeriCorps Vista because I wasn't exactly sure what I wanted to do in public health, and I knew this would give me a lot of experience. I worked in a local public health authority and was able to work with a lot of the different programs. And I did work around public health accreditation and public health emergency preparedness. And that actually really set me up for the other positions that I've had. So then from there, I got full-time work at a different local public health authority, again, because of people I knew. There were some people on the team who was like, "Hey, the place I work for is, hiring." And so I was able to get a position there. And then similarly, as I built my network, then a position opened up at the public health division for the Oregon Health Authority. And because of all of the experience and network thing that I had done within the region, that helped put me in a good position to work for the state, specifically doing public health emergency preparedness work. And then through all of that work, that's then how I got my current position as a manager, because building your network, then people know what your strengths are, your areas of improvement, all of that really helped throughout that interview process too.
Thank you.
I would say really understanding that like public health, this field is very relational. So really building your network, like Haley said, I think starting early as you're looking at things too is helpful. Just being aware of what the job market looks like, or even internships that were available. I know for me, I got my internship through my one of my mentors who I was also doing a graduate assistantship with, and that's actually how I got my position as an EPI. But looking at for other positions that I was applying for, I was definitely talking to folks, attending things like this. And then even talking to professors who interests may align, and even the internship coordinator.
Well, there's also the Catalyst program as well, and so I'm a mentor for that. And then I've mentored students, and then I've served as a reference for them. And I know some of the places that they're applying to. So I can, like, as I'm just doing my normal day-to-day stuff and talking with colleagues, I can say, hey, I know some students who are graduating soon and they're interested in this type of work, and then they can do kind of a, like a, not like a full interview, but kind of get like an idea of the place before they apply and do all of that type of stuff as well. So public health is very relational.
I was actually a mentee during my final year of my MPH program, and the person that mentored me actually wrote my letter of recommendation and was a reference for jobs and things like that. And that was super helpful. And then when looking at jobs and even like being unsettled of not knowing like where my position was or how to, or like my job description, my future, like they talked me through it, which was super helpful.
You're talking about networking, and I think that's something that oftentimes, you just hear out, you throw it out there, like communication is good. Like, okay, well, that's very broad. Like networking is good. Like, what does that really look like? And I really appreciate the three of you for going to touch on that. If you want to go into more depth, I know that a lot of students, at least when they're talking to us at the Alumni Association, that's a big question about like kind of being nervous about the fact that like, how do I really network? What's that really look like? And so if you want to weave it into this next question, you certainly can. Knowing what you know now, wherever you sit in your career and gone through your educational process at Oregon State or at other institutions, what do you wish that you could have told yourself back then that would have helped you prepare, or maybe be able to seize a different opportunity, so on and so forth? What would you like to be able to go back and say, like, hey, if you had been able to do this, it might have been more helpful. You learned something that maybe through a difficult route that would have been a little bit easier. Or you can talk more about networking too. That's fine as well.
Well, I think for mine, they're kind of related. I think I wish that I would have done more internship or more like networking at local public health authorities and just asking my professors, hey, who do you know? Or, in doing more of that, or with my, like with the other students in my cohort, like asking them more questions about their internships and their field experiences to get a better understanding of what is available and how I could have been connected with other folks. I think that's part of what I learned through my year of AmeriCorps Vista, because that's a lot of what we did. And for a lot of the people that I did my year of AmeriCorps Vista with, we still connect, and I'm on the same team as some people, and so there's a lot of that kind of keeps going around. And then also, if you're interested in going into local or state public health, is understanding state statute and local policies and how the different government levels work. So at the county level, the Board of Commissioners and like county code, things like that. And then at the state level, what that looks like for like Oregon Administrative Rule and Oregon Revised Statute. That's a much bigger part of public health than what you might think when you're, doing some of the different coursework and things like that.
Marissa or Evan, anything that you want to add?
I have a couple. So I think one of them is really pace yourself. And in terms of taking classes, for me, trying to take classes that help build skills rather than just doing content area classes. I know when I was an undergrad, for instance, this was before the ACA was being rolled out. So I learned a ton of health policy. And then like 3 months later, some of the stuff I had to relearn. So just keeping that in mind. I think also in terms of internships and classes, this is the time to really try different things. Even if you're not remotely sure that you might be interested, it's a great way to know what you don't like. And I think those are things to keep in the back of your mind while you're looking for internships and like careers. I did not think I was going to stay in Oregon. And like Haley said, knowing local statutes, I ended up staying in Oregon and having to learn about the CCO system and local statute, which is very different from Southern California. So that was a quick learning curve. And it's not hard to do. You just need to take the time to do it. So yeah.
Thanks, Marissa.
I'll just briefly add that I kind of said it in the larger introduction of the entire thing, but you know, the coursework can be great. It can also be distracting, to be honest. If feeling like you have to take more or that classes will give you everything, they're important for sure. Certain ones more so than others, as you've surely found out. But the other stuff matters, I think, a lot. I've never had one person in any interview or any job or any volunteer work say, hey, did you take this class? Or what classes did you take, right? It's like, what experience do you have being a leader? What experience do you have using this software? What experience do you have doing this or that? And none of it's like, oh, yeah, I had a class on that. Maybe you did, right? GIS or using programming or something like that. But again, very limited in scope. And so I think volunteering, AmeriCorps, faculty search committees as a student rep, student representative on your professional organization's board, whatever it is, right? There's a lot more to be said about how you perform and how you behave, and then what you get out of that, right? If you volunteer for this committee, and then these 3 faculty can now say that you were timely, you had great feedback, you're willing to speak up, you had great insight, you know, that can go a long way for asking for a letter of recommendation for graduate school or applying to jobs. I have been and continue to be very fortunate to have some great mentors going back to high school through undergrad. All 3 different graduate programs I've been in, every single mentor I've had has been amazing, which is, again, very fortunate. It's not always the case, but from a very early stage, I was given nudges in that direction of going and doing things, you know, outside the classroom. Because again, I think those hold more weight as you leave school in terms of how people perceive you and your ability to do work.
Thanks, Evan, and thanks to all 3 of you. I want to make sure that if someone has a burning question that they're ready to ask, they can. Otherwise, I'm going to throw it over to David. And I'm not seeing anybody jump on with their camera or raising their hand. So just consider you all to be very shy or extraordinarily comfortable with whatever you're doing. And so, David, over to you.
So, you know, I think one of the things that typically pop up when I'm talking to students as well is this idea of knowing that you're on the right path, whether this is, you know, the right program for you, the potential career path for you. And I guess this question really is for all of you. Was there ever really an aha moment for you where you figured out, you know, maybe it's time for me to make transition and then went into a different program or career path? Or maybe it was that aha moment of finding yourself, this is my calling, I'm in the right place.
I'll go first. So I would say, I mean, I've had different positions. I've worked at state and local public health, in undergrad and all that. I had all different types of jobs. So I would say through a lot of it, it's a kind of going back to that growth mindset. Like, it's a continual journey throughout. Like, I didn't think I was going to end up being in public health emergency preparedness, but I really like it. Even though, like, I see for some of the work, like, I see people on their worst days. And so, like, going through all of that, so even when the days are really tough, like, I know that I'm in the right place. Like, I know, like, I have a desire to keep moving forward and helping others and building better systems and engaging, with public health students and all of that. And so I think that's part of being a professional, is like journaling and taking time to reflect and making sure that you have good self-care. So then you're not getting burned out because you're adding too much stuff to your plate, because that's also part of it too. Because I've been in those positions where I was getting burned out simply because I was doing too much, even though at the core I liked the work, but I was pulling myself in too many directions. And then I think that also, like what Evan was saying around having mentors, like these are the people who know you and will provide honest feedback on, hey, it seems like when you do this type of work, this is where you really shine. Or, you know, when you do this other work, it doesn't seem to be your favorite, or, you know, and so having those conversations is really important. So it's not just you, it's you being in community with others and having that. And just like on the personal side too, I mean, so my husband used to do marketing, and this year he decided he was going to become a math and science teacher. So he's in school right now, and he's now teaching 6th grade math and science. Like a completely different change of path. And that's good too, because like he brings a different perspective in and has these different experiences to help provide real world experience for the kids that he's teaching, because he's done a lot of different things in his life. And so I think that like as a hiring manager, that's something that I find to be really fun about building my team, is taking people, like finding people who have all of these different experiences and want to bring that in. So yeah, so I think there's, at least for me, there's not like a aha, I am doing this thing I'm going to do for the rest of my life. It's like, you know what, no, this is validation or confirmation that right now I am in the right place, and we'll see where life takes me.
Thank you for that.
So for me, I really zigzagged in my like educational and career paths and like what I did. I was originally pre-nursing, and then I was going to go nursing school, and then I thought I wanted to be a health teacher, and then I was like grad school, I want to be an academic, and things like that. But as I went through each experience, I really knew what boundaries I wanted to set and things I did not like and things that I did like, and kind of steered in those directions. I think also, like everyone else has said, like knowing, having your mentors who might see skills that you might not necessarily see in yourself is super helpful to identify. And I think also trying to utilize, for me, like utilizing different resources like on campus, and trying to find new things that might lead to that aha moment. So for instance, one of my really good friends that was in the MPH program went outside of the college and was taking policy classes. And I thought policy was super boring, but she would talk about it and talk about econometrics and data analytics and things like that. Because of her and talking with her, I actually went and applied for a second master's in the public policy program, and that has been super helpful in me wanting to like bridge the gap between public health policy and medicine.
Thank you. Evan, anything to add?
Very briefly, just that it's, although it may not be obvious from your positions, but it is incredibly normal and accepted to not know what you want to do, including when you're in the middle or end of your career. You ask anyone and they're like, I don't know what I want to be when I grow up, and they're 55, you know. So it's normal to change paths, to have new interests. In fact, in a lot of different fields, it's expected, right, that you're changing jobs every few years. Not all of them, but some of them, that's expected behavior. So short but sweet point is that it's normal to not know, and it's okay to change many times over the course of your career.
Thank you.
Haley, that absolutely terrifies me, that someone just like such a 180 going from marketing to science and math teacher. You know, I got to imagine he probably has a liberal arts background like I do. I'm just like, you don't want me teaching you science and math. And so I'm glad he's so versatile. That's absolutely incredible that he's just like, nope, doing something completely different.
Well, he actually has a degree. He's also an Oregon State alum. He actually has his degree in fisheries and wildlife, ended up going into marketing, and then is coming back. So it's, I mean, there you go. You never know where you're gonna be.
Caitlin, I'll hit you up here in just a second. I got one other question, and then I want to come to you from one of our viewers. I'm an international student in global health with a global health major, and from Japan. So I don't have a network here, and I have not been involved with any other volunteer or activities. You know, in this case, is there a recommendation from the panel how to really start building community? And building community is so important and can be so daunting. And so, yeah, like, again, like where to start. So Marissa, Haley, Evan, if any of you have anything that comes immediately to mind about building community, especially from maybe from a global health perspective about an organization or a group or volunteer opportunities, anything like that. Marissa?
I would say start with your professors. They usually are well connected within the community. And then if you find any community programs and things like that that you're interested in, to show up. I know I used to show up to this like in Corvallis, this health innovation meeting that was every week that was with the CCO network. And that's how I actually met a lot of the community members and kind of got directed towards different opportunities. Also, there's a lot of mentorship programs for students, not just within OSU campus, but also outside. So if you're planning on wanting to move to the East Coast, looking at you can look at different programs through other colleges that will help network and bridge that gap. So I would definitely look into that.
Yeah, and professors can help get you connected with, you know, with alumni. You could do, you know, different, I can't think of the term, but like basically ask them about what they, you know, what alumni do for their work. How did they get into that? I mean, from when I graduated at Oregon State, which has been a few years now, I mean, there were quite a few people who were doing global health or had global health experience, and they want to bring those experiences back to the work that they wanted to do in the US. And so there's a lot. And so just asking and definitely getting involved in one of the mentorship programs. I wish I would have done that as a student.
And that would be the Catalyst program would be a great start with that, right?
Yeah. And the Catalyst program does a really good job of matching people up with, like matching the students up with mentors who have very similar interests, whether it's what they do professionally or in their volunteer work, or they have done professionally. So that really helps to open up, because I mean, as a mentor, I've then connected with some of my mentees with other people of like, hey, you should reach out to this person and ask them about what they do. And they're like, oh, well, that's, you know, that's helped them a lot too.
Thank you. Appreciate that.
And speaking as a mentee for the Catalyst program, they did a really great job of like building a portfolio, because I know that they had me like redo my resume and my CV and things that I can show to future employers and things like that, which is super helpful. And then the other thing that I would plug is if there's anywhere that you want to end up, definitely check those things. I know the CDC has like a fellowship program for international work. AmeriCorps has something similar. So definitely try looking at different governmental agencies, because they usually have fellowship programs that you can apply as a bachelor's or undergrad student.
I know, Haley, you said you did AmeriCorps Vista. Would that be something to also look into? Is there a really great place to kind of go and start there? Just, I mean, would just do a search engine for AmeriCorps Vista. Would that be another opportunity in your opinion?
Yeah, and because there's different types of AmeriCorps Vista programs. And so, you know, that's kind of like the Peace, like the domestic version of the Peace Corps. And so there's a lot of different opportunities. And I know some of the state coordinators for some of the different AmeriCorps Vista programs as well. So if folks are looking at that and they want to get connected with someone, let me know.
Excellent. Evan, I didn't want to forget about you. Do you have anything you wanted to add as well? Or are you good?
I think just go ask. Yeah, it's surprising how little interaction sometimes faculty or professors get from students, maybe because they think they're too busy or whatever, but many of them are very willing to share their experiences or connections. It can be sometimes daunting to ask, but it can be that simple, honestly, and you never know what you'll get. And the worst thing is they don't have anything for you, right? And then you still made that connection with the faculty, and maybe they have a recommendation for who to talk to next. So.
And I'll also say, as the director of alumni relations, you can also come to me and we can try to connect you with an alum as well. And so that's also why I'm here as well. So I would say feel free to connect with our panelists or myself. I hope that was a helpful start. And Caitlin, you have a question.
Hi, yeah, this is kind of more of a technical question, and I'm sure it will have some varying responses, but in anticipating job searching, I was wondering if you have any insights into, like, is there a typical time frame that jobs are posted, like maybe for local public health or state, or within, you know, if you are kind of more in industry, if you have any insights into that.
Well, with COVID, there have been a lot of positions posting because we actually have much more funding for public health, which is nice. But if there's certain types of positions that or places, like specific agencies or parts of the state that you're interested in, that's kind of where reaching out to talk with some of the staff is helpful, because then you're demonstrating interest, and then they'll kind of give you an idea of when positions are going to be posted. I wouldn't say there's not, I mean, like for the Oregon Health Authority, we always have positions posted because there's hundreds of people that work for actually it's probably thousands, because it includes like the Oregon State Hospital and folks like in like positions like that. So there's always positions being posted. But I would say one of the benefits for being an Oregon State alum is Tanya is really good about sending out emails of different job postings. So I would say like keeping track of that, and those like that really helps. So then you know when positions are posted, because I use that to hire or it's like to post the positions that I'm hiring for as well. But it's not like every March is when we have a whole bunch of stuff. I would say really the only time that we have that is more of when something has been passed through the state or federal legislature that increases public health funding. And so then from there, like whenever that program, for example, like the psilocybin work that is starting up. So when that got passed, then we will be putting a position description together, and then we'll be posting for that. So there's those types of positions, but I would say most of the time it's just kind of keeping an eye on the places or the types of agencies that you're interested in. If you are interested in rural public health in Oregon, there are a lot of positions posted, just saying.
I know from my experience, looking at fiscal year, when places end, you'll see sometimes new job openings, but if, like Kaylee said, just kind of keeping an eye out. What's super helpful is like different organizations, like for instance, OHA, you can put your name on this email list, and they'll send you like all the job postings that you're interested in. I know local county health departments do that too, and even some industry ones. And then I would also rely on things like Handshake, your network also, and then like LinkedIn and those different types of platforms that can be helpful. I know if you're looking for something outside of Oregon, they're doing a lot of hiring within Oregon, but I know there's also a lot of remote work that is going on for like public health, COVID-19 and things like that.
All right, well, we're nearing the top of the hour. I want to see if there's any more questions that anybody has before we get out with one last one for the panelists. So this is one of those moments where if you want to ask it, go ahead and raise your hand or let me know. Otherwise, okay, this is for each of the panelists to kind of end the evening. But before we do, I want to thank everyone for being here. I want to thank our panelists for being here and taking some time. We hope that these type of events are really helpful to connect alums with students. This is exactly why we like to do these types of events. And so it doesn't matter to me about who wants to go first, but basically like things that you want to close on, you think are really important that maybe you've touched on or you want to touch on again, or one last thought to leave with the students this evening from your perspective, or even like pearls of wisdom for being out there during COVID-19, and especially, if public health worker, maybe even in rural counties, maybe in like all the way across the board, if it's just like, hey, you know what, you are appreciated, just your pearls of wisdom for the evening.
Go ahead, Marissa.
I would say that I know talking about career stuff and future stuff can be really scary, but really take your time, pace yourself. I think now is the best time to be in this field, unfortunately, because of COVID-19, but with the renewed interest with public health and having a pandemic going, there's a lot of new opportunities. And definitely rely on your support system, professors, friends, resources on campus. I know they seem like small things, but there's something that actually can be very valuable.
When talking about small things, like this might not have felt like a huge thing to do, but this is the kind of stuff of putting yourself out there, listening, hearing what's going on, seeing that other people have similar same questions as you is really important for, kind of going back to the first question of imposter syndrome. Like other people are in the same position as you. Like people want to get a job afterwards. And, so there's a lot of these types of opportunities to put yourself out there in small ways that then helps you, have difficult conversations as a professional on all different types of things. And so if you haven't done so already, work to find a mentor, get connected with alumni and ask questions, and, go to the career center and ask for I think you can do like resume and cover letter reviews. Like I've done that as as an alumni of like many years past. And I was like, I should know how to do this, but I need a few touch-ups, so really do that kind of stuff, because, as a manager, these are things that I'm looking for. I want people to ask me questions. I want to know what you don't know, so then I can help you grow. So this is a really good step forward.
And you want to close this out?
Sure. I was a pitcher in college, so it's a little bit fitting, a closer here. But
Not any music going?
No. Yeah, I would just say go do some things, right? Whatever they are, whatever's interesting to you, just go do something, right? I mean, it can be hard to go do something, but I think with the abundance of choice or the fear of this, that, or the other, it's easy to not go do something, something new, something hard, something challenging, but just go do it. Sort of being fearless in terms of taking on opportunities or asking questions or doing something new or different, I think is a powerful tool that you'll learn early on, and it will continue to be fruitful for you for the rest of your life, whether it's in work or relationships or whatever else you do, right? Is sort of that attitude towards new things. And it can be hard to let go of this sort of linear, uncluttered path to success or your future, your career. But as you've heard today, and I think you'll hear from most people, professionals, older people, is that that's the normal thing. It's abnormal to have a straight linear, uninterrupted path to wherever you might be at that particular moment in time. So being comfortable with that, I guess, accepting the ambiguity, the indecision, the fear, whatever it is, it's normal, accept it. The struggle is okay. That's how you learn from things. As long as you look at it the right way. It can be defeating as well. So I think approaching things with that mindset can go a long way to allowing you to grow in your roles, whatever they might be. And that sort of this sterile narrative of, I went to school for this thing and now I have this job doing the same thing and I'm gonna do it forever. It can be dangerous. So allow your life to be chaotic, I guess. If you kind of look back and trace back, it's like, I don't know how I got here, but every single thing that I've done and continue to do is traceable back to something else I did in the past, right? Whether it was a person or a class or a opportunity or a coach or a friend or a, whatever it might be. It's all traceable, but it's kind of an ugly mess of a 3-year-old drawing on a coloring book. It doesn't fit neatly, but it's worth it in the end. So just go do something, do the thing, learn from it, and keep going forward.
Take action, lean into the uncomfortable, and enjoy the chaos a little bit. There's a pattern there. I swear that there is. Haley, Evan, Marissa, thank you very much. David, my co-moderator this evening, really appreciate it. As you can see in the chat, you can connect with the different panelists. The Alumni Association is here for you as well. We do resume reviews. There's osuconnections.org, which is our new platform that is growing, where students and alums, or alums and students, or alums and alums, or students and students can connect with each other, different kind of mentorship opportunities. The Catalyst one, I work with Amy on that. She's awesome. And obviously Marissa and Haley, part of that as well. So lots of different things out there. If you ever have any questions, please do not hesitate to reach out. And I just really appreciate y'all being here, and hope you have a wonderful rest of your evening and a good rest of winter term. Stay safe out there, and take care. We'll see you down for another episode or something else from the college or the Alumni Association. So take care. Have a wonderful evening.
Thanks, Casey.
Thank you.